First trimester screening is an optional screening test that is available for all pregnant women before 14 weeks. This presentation will help you decide if this screening is right for you and your family. First trimester screening provides information on 3 genetic conditions called trisomy 13, trisomy 18, and trisomy 21. The most common of these is trisomy 21, which is also called Down syndrome. Most people are familiar with Down syndrome, which causes mental retardation and sometimes other health problems such as heart defects. Some individuals with Down syndrome are more mildly affected than others. Trisomy 13 and trisomy 18 are less common than Down syndrome, but more severe. Babies with these 2 conditions usually have many birth defects, growth problems, and mental retardation. Most, but not all, babies with trisomy 13 or 18 pass away during pregnancy or shortly after birth. In every pregnancy, there is a possibility that the baby could have one of these 3 conditions. First trimester screening can tell you whether there's a high or low chance that the baby is affected. Since this is not a diagnostic test, the results cannot tell you whether a baby definitely does or does not have one of these conditions. The first trimester screen is performed between 11 weeks 1 day and 13 weeks 6 days in pregnancy. The screen starts with an ultrasound that does several measurements of the baby. The ultrasound makes sure the baby is not too big or too small for this screen. Then measurements are taken of the fluid at the back of the baby's neck. A large amount of fluid at the back of the neck can increase the chance that baby may have Down syndrome, trisomy 13 or 18. Often, the top of the baby's nose is also measured. A small measurement of the top of the nose may be seen in babies with Down syndrome. Some healthy babies have measurements that are larger or smaller than we expect. This means that the ultrasound cannot tell us for sure if something is right or wrong. The ultrasound for this screen is limited to these few measurements, and it is too early to know if baby is a boy or a girl. After the ultrasound, a finger stick takes 5 drops of mom's blood. In the blood, 2 hormones are measured. Babies with Down syndrome, trisomy 13 or 18, often show abnormally high or low patterns of these hormones. The measurements from the ultrasound, the blood work, and the mother's age are then combined together. The results from this first trimester screen indicate whether a baby has a high or low risk for Down syndrome, trisomy 13 or trisomy 18. This first trimester screen detects over 90% of these 3 genetic conditions. Your screening results will be available in approximately 8 days. If the first trimester screen result is negative, the baby is at low risk for Down syndrome, trisomy 13 or 18 in the current pregnancy. After a negative or low risk result, families are offered the option of additional screening for spina bifida and an ultrasound around 20 weeks to evaluate baby's growth and to look for general birth defects that this early screening cannot detect. It is important to know that a negative result cannot rule out the possibility that baby may have one of these conditions. If the screen result is positive, the baby has an increased or high risk for one or more of these 3 concerns. The result is only able to tell us that more screening or diagnostic testing should be offered. A positive result does not tell us that a baby has one of these conditions for sure. Approximately 5%, or 1 in 20 women who have first trimester screening, receive a positive result. After a positive result, the patient meets with a genetic counselor to discuss the result and additional recommendations. A more detailed ultrasound and an additional optional test called an amniocentesis will then be offered. An amniocentesis is the only way during pregnancy to know for sure whether a baby does or does not have Down syndrome, trisomy 13 or 18. An amniocentesis is a procedure during which a fine needle is inserted through the abdomen and into the uterus to collect a small amount of fluid from around the baby. The fluid contains skin cells, which are tested for chromosome differences, such as trisomy 13, 18, and Down syndrome. Amniocentesis is a diagnostic test which gives a definite yes or no answer about these 3 conditions. Amniocentesis can include mild discomfort as well as a small risk for complications. The first trimester screen is entirely optional. You can choose to have the screen completed, or you can choose to decline this option. There are other options for screening of similar concerns that could be done later in pregnancy, but these options may not detect as many babies with trisomy 13, 18, or Down syndrome as the screen we are discussing today. Other options may include a quad screen between 14 and 21 weeks or an ultrasound at 20 weeks. When considering the first trimester screen, you should think about what you would do with a test result that comes back with a low or high risk for these concerns. You should also consider whether you would find it important to know if your baby has Down syndrome, trisomy 13, or 18 during pregnancy.
I knew I would never consider terminating my pregnancy. I decided to take the first trimester screen so that I would know ahead of time and be prepared if my baby was going to have special needs. I didn't want to get a shock when he or she was born. I felt like the more information I had, the better.
I decided to have this screen because I was considering ending the pregnancy if I found out the baby had a severe developmental problem. I felt like I just couldn't take care of a child with special needs.
I felt like the screen wouldn't change anything for me, and it would just cause me to worry if the results showed a high risk to have a baby with a problem. I decided not to have the first trimester screen at all and just wait and see.
Remember that the decision to have first trimester screening is entirely up to you, but it can only be done during a specific 3-week period during your pregnancy. If the baby measures outside the time frame of this screening test, other screening is available. Feel free to ask questions and discuss first trimester screening with your provider before making the decision that is best for you.